Edison Open House Global Healthcare 2021. In this session, we're going to be looking at the work of Volition. It's an epigenetics company developing simple, easy-to-use tests for early diagnosis of cancer and other diseases. With me is their CEO, Cameron Reynolds. Cameron, welcome.
Good morning, Vivienne. How are you?
Good. Now, you're an epigenetics company, and a lot of people will be thinking, what on earth is epigenetics? So let me just start you off with a kind of the dummy's guide to epigenetics, and then you can take us on. But epigenetics, so if you think of your genome as kind of your body's instruction manual, and you think of it like a whole collection of recipes, then epigenetics are the post-it notes that you put on a particular page saying, make 10 times more of this one, don't make this one. And those post-it notes are really are put on in response to environment. So things going on in your life. So that is the dummy's guide. Now take us on to Volition's particular take on epigenetics.
Yeah, epigenetic-wise, there's a way I prefer to look at it. I'm not a scientist myself, so I've learned all this. We have a huge scientific team at Volition who've done an amazing job at revolutionizing this area we're working in. The way I prefer to look at it is the genetics, is the hardware, like in the computer sense, and the epigenetic is the software. Or as our chief scientist said, the genetics is the plans for an entire city, and in our case, the entire cells, our entire being. And the epigenetics decides what's built, where, when, how, and what's destroyed. So the genetics is obviously important. The plans for the city are obviously very important. But the epigenetics, which actually means above genetics, is incredibly important as well. And I think it's very fair to say in the last 10, 15 years, there's been a huge amount of emphasis on the genetics since the human genome was mapped, a few decades ago, and the epigenetics are extremely important. And we started 10 years ago with our scientific team, who are a world-renowned group. Dr. McAuliffe worked for the World Health Organization for a few decades, making simple ELISA-based tests. So we've always thought the epigenetics are incredibly important, and I think that's really coming to fruition now. We've managed to spend the last 10 years getting the platform incredibly stable, dynamic, robust, that can really read the signals on the nucleosome. The exact chunk we look for is nucleosome bound. It's a big word most people haven't heard of and don't understand what it is, but they do understand DNA, and there's 200 base pairs of DNA roughly to every chunk of a nucleosome. And there's a large protein structure there of about 8, 9 proteins, and it's a very complicated switching mechanism, if you will. And as you're probably aware, in computers, like in humans, the hardware and the software is often where you find a lot of the problems. So we've really been on the same path for the whole existence of the company, showing that these epigenetic changes are very important. They're there, they're very important, and they can be measured very simply and easily and quickly on a very robust platform. And that's really where we are now. We haven't absolutely been a company of research and development. We've dominated the space of intellectual property where we are. We have a fantastic platform. Now we're using it in a very wide range of areas, because I think we've really cracked something very special.
Okay, now if you would, link nucleosomes to early detection of cancer for me.
That's a very good question, Vivienne. So ultimately, typically we look for things in the tissue, things like biopsies, or looking for detection of disease is usually by counterintuitively looking at it. A colonoscopy is looking for the cancer with the human eye, a lung scan, mammographies, all these kind of things are looking at it. Where most diseases are actually found through blood tests, because they're very easy to do, they're routine. And most people have a sense that they go to the doctor for a blood test for cancer, and that really is absolutely not the case. Only in very rare cancers you actually get detected primarily by blood tests, things like prostate cancer with the PSA. So what we look for are these epigenetic changes, which have been known to be, and because they're the very cause of the cancer, miswiring, a switching, if you will, in the epigenetics, they're very early there. And because the changes are genome-wide, meaning they're on a wide range of nucleosomes are altered in the chromatin, you get a very large signal in the blood from even an early stage cancer. So it's been shown for a long time, these are different in the tissue. That's where you look for the cancer, in the cancer. But as cells die, there's a lot of turnover of cells. And you're probably familiar, as the listeners, that cancer is very dynamic, a lot of births and deaths of cells happening. So a lot of these get, and the body cuts up the chromatin into nucleosome-sized chunks to be reprocessed. So if you have cancer and a lot of other conditions which we can go through, you not only have a raised level of overall nucleosomes in circulation, but they have very specific epigenetic changes. And there are hundreds and hundreds of structures on the nucleosome, every one of which we've applied for or got is intellectual property, as well as every method of detection in every living thing. These nucleosomes are not only a factor of cancer, a lot of other diseases, which I can go to later, but also in the animal world. We've launched the very first product is actually in dogs, where we used, we joke we're one of the first companies to use human trials for veterinary products, but we really perfected the platform and shipped the kits to Texas A&M, who are a wonderful group in the vet space, one of the world leaders, and they use the human kits and it worked incredibly well on a range of dog cancers. So during the pandemic, it's just much easier to launch products in the animal space than the human for a lot of obvious reasons. So that's how it works with early detection. The nucleosomes are there, they're different. We've spent 10 years now in a fantastic facility in Belgium, adapting a platform which can really measure them very simply, very quickly, very cheaply. And our ethos has always been to keep it a very low cost, routine blood test.
So just to be sure I'm getting this, that these tests are specific to a particular cancer. In other words, you don't do a test and says, you know, you've got cancer, but then you have to search for where that cancer is. These epigenetic changes are very specific to particular cancers. And is that also true of the primaries and the metastases?
Yes and no. So there are a lot of changes which we have shown are actually common between a few cancers. So some of our assays you can certainly could be taken as a pan-cancer assay, but that's very tough unless you're very, very specific, because it would just terrify someone to say, you have cancer, we don't know where it is.
Of course.
Because the follow-ups, overdiagnosis, they call it, and you're going to be wrong. Some of the no test is perfect, so you could actually be wrong and put someone through 20 different tests which cover problems. So we're starting in the biggest, most prevalent cancers, and we are finding different panels. We work on different assays on different cancers. But you start, the easiest way to start in the assays which work in a range of cancers is to add it to a certain other product, some other system currently in the system. For example, we're just about working on some projects which we'll have data on soon in lung cancer, and the primary screening device at the moment is low-dose tomography. So the problem with that, it's very sensitive. It picks up the cancers, but it's not very specific. There's a lot of other things it picks up. So we're looking to add our assay to the lung, and if you have a lump in your lungs and our assays are high, it's very, very likely it's lung cancer, for example. But we have a lot of work to do. There's huge numbers of epigenetic signals. I think there's an extremely good chance each one does have a different signal, but you're not looking to do all. I mean, theoretically, there are 200 cancers, but the major ones make up the majority of cancers shown. So we're working on some big cancers. Our big project's always been colorectal, which actually is a screening test. We're doing a 510K in the US also for blood cancers. And I think what's important to understand is how does a small company do all these things? It does it because it's exactly the same platform. What we spent a lot of time, effort, and a huge amount of work from our fantastic team is getting the platform really stable and developed. We're the only group who've looked at these chromatin structures in circulation. And there's a lot of very smart people working on cancer detection and other diseases, but I think they're all going down the same path, which tends to be very, very complicated and expensive. And you can get good accuracy and very high accuracy with some of the tests if you go really complicated, really expensive, huge amounts of blood, very expensive products. But that's not going to be a routine blood test that the vast majority of humanity can actually take. So we're in the process now of just order of magnitude. We're looking to launch, in $100, $150 in the human space for the first level of test, which is very affordable. Most of the other things are well truly in the thousands of dollars. And it doesn't sound big, but if you need 10 or 15 mils of blood, that's a lot to take out of a sick old person. So I think we have something very special. The epigenetics is really, really important. We dominate the space, and now we have a very stable platform that can launch products. So it's all really coming together.
Fantastic. Tell me about your veterinary business, because you've got two businesses, essentially human and veterinary. Where are you in the veterinary space at the moment? Let's deal with that one first.
Yes, that's an interesting one, Vivienne. So obviously we don't have any expertise in the vet space. our chief scientists work for the World Health in oncology and women's health and other things. What we're expert as is making ELISAs. So we had a connection through our Belgian group to Texas, kind of different Texas and Belgium, you wouldn't necessarily think necessarily. But anyway, we spoke to Texas A&M's vet school, and they obviously, something our scientists knew already, that the nucleosomes are preserved through species, and even things as varied as yeast. Actually very interesting how common it all is. And the vet market is even worse than the human market for how it's serviced by oncological detection. And dogs tend to get a lot more cancers than humans for a couple of reasons. You're probably aware they're quite inbred. The pure breeds are very purely bred, intentionally so. So they and particularly breeds are very common to get cancers. But also the reason there's about 2 or 3 times more dogs diagnosed in the US than humans every year is not just a function of that, it's a function of the life cycles of dogs. Cancer tends to be when you're older, when we're 60, 70, 80, 90, but dogs don't live obviously to that age, and they can get cancer at 5, 6, 7 years old. So you have a lot more dog life cycles. And you're probably aware we spend a lot on our animals, we care about them a lot. So it's a market which can be very profitable. It's not something that you have to, you can charge very, very similar amounts to the human market. And also the regulation, the Texas group are incredibly caring of the animals, but it's not something you need a 10,000 human person trial on, which can cost a lot of money to launch a product. So we sent them some kits, and they tested in the 2 most common dog cancers, lymphoma and hemangiosarcoma, and the results were spectacular. 87 and 97% AUC with one assay. It was absolutely off the charts. And then we learned from humans, so we hadn't actually looked at non-Hodgkin's lymphoma and the other blood cancers in humans, and we did, and we got extremely similar results in the human space. So, during the pandemic, sometimes things hit you in there from behind. I think you've got to pay attention. It wasn't our plan. We're on the track of colorectal and lung, but a big US trial has been paused during the pandemic for collection for colorectal, because we're not giving colonoscopies at the rate we were, so they paused collection. So it seemed like a very good way of really showing, now the platform's developed, of really showing what it can do. And we launched late last year, and through the GI lab at Texas A&M. And it's a very high margin product for us. It's a very accurate test for the animals and for the vets. So we started sort of a beta launch in Texas, because no one's ever launched a blood test like this in the US or anywhere in the animal space, because nothing's ever really worked. So we started, and we're now in the process of making sure it all works well, and doing a big launch in the next few months US-wide, and looking to make it more international. Also, cancers and disease progression in these cancers. So I think it's potentially, there's 77 million dogs in the US. Something I didn't really realize is how much Americans take their dogs to the vets. I think it's starting to spread more in the rest of the world, but I think the figure we found is 83% of American dogs go to the vet at least once a year, which and they do annual wellness tests, which this can be very much added to. So, so if the 77 million dogs, about 2 million a year get these cancers. So if you just get and about 22 million are at the age you'd give this test to the dogs to see if they have the cancers. So potentially certainly millions of tests per year, and our margin's about $45, or for what the revenue to us is $45 per test on a very high margin, because it's an ELISA, so it's a low cost thing to make. So I think it's a very interesting market. I think we can do a lot of good in the vet market. And I think there's going to be a lot of good news on that throughout the rest of this year and into next.
That's so interesting. And I don't think people realise just how much is coming from the animal market now into humans, things like orthopedics, and now this. It's very interesting.
Yes.
So let's go into the human market. And where are where are the advances coming in the human market, and what's the time frame for that? I know that you're a multinational company, so perhaps you could take us through that.
Yes, we're a multinational, a small multinational to be fair, but we have a small team in Asia, in the US, and of course in Europe, where our main facilities are. And I think our aims are very ambitious. I think it's very, very plausible and possible we could really become something which the vast majority of humanity take at the appropriate time. I mean, cancer testing you tend to do later on. Some cancers are different, but and in a range of other diseases, the chromatin fragments are very, very important. So we have a strategy in Asia, and obviously the big important markets are India and China, where Dr. Quay, who works in Singapore, has been a lot of work on launching the first products there. Also, ASEAN, Southeast Asia, people forget, is over 600 million people as well, so that's certainly a big market. The European strategy, we've just hired our first sales person in Belgium to help launch the first product, which is the blood cancer product, as well as organised trials. We're doing some work on netosis, which is related to COVID, which I can get to later. And our team in the US have been organising large trials in colorectal cancer, which has been paused, as I said, during the pandemic. And in Taiwan, we have 2 very large studies going as well in colorectal and lung. So I think all the development's gone on in one place in Belgium. If you look at our website, it's a fantastic 20,000 square foot building. We've just bought the one down the road, another 10,000 square feet, as an R&D and production hub, so we can produce all the key components in-house. And then our strategy for marketing has always been to launch the first products ourselves, just wait around. We want to be a big licensing company, but it's very tough if you've never had a product, haven't proved it work, to get anyone really to give you a good deal. So to prime the pump, if you will, to get things moving, we've launched the first vet products. We're looking to license. We launched the first cancer products in humans. In the blood cancer space, we're doing large trials in lung and colorectal. And the aim of it all is to launch some of our own products, provide a solution on a machine. At the auto-analyzer we use, we have a solution which is high throughput, also plates for smaller labs and other areas. And we're also working on point of care, which is a paw print in dogs, but a finger prick in humans, to provide a kind of a point of care test as well. So I think to really dominate the whole market, you can't just have one solution or the other. You need to really be, and being an ELISA, it's the most common form of tests. You can really be from the very large machines, from the large companies, to smaller machines, to microtiter plates, which can be run in any lab in the world, and also point of care tests. And there's a really good range of those being developed now. And because we can work on the ELISA platform, because the marker we're after is very common and a target which is easy to do on the simplest platform, it means we can launch in a very wide range of areas. And that's exactly what we're doing. For example, in the vet market, we started on the microtiter plates. We're moving now to the auto-analyzer machines for higher throughput. They can do up to 500 tests a day. And we expect to be able to launch the first data and the process for launching the point of care, which again is like a pregnancy test or a home test or a doctor's office with a little machine, those kind of things. So we have a strategy for different platforms and for all the regions as we develop a very wide range of products. And I think when we started 10 years ago, we couldn't have dreamed how widely applicable nucleosomes and the epigenetics are. From all the cancers, a very wide range of other conditions, and as we talk about the vet space.
So widely applicable, cheap, which is important, and just tell me the other conditions beside cancer, just briefly.
The most obvious one, so it's difficult during the pandemic, and obviously there's been a lot of deaths from COVID. What actually kills you in COVID is something called netosis, N-E-T-S, is nets. And it's the body's primary defense mechanism to a virus. The white cells spray out. It looks a bit like a jellyfish, if with long chains of chromatin with little bits of poison on, which try to trap and kill the virus, which is excellent, unless, of course, you have a cytokine storm, which means there's too much of this produced, which is what causes the lung problems, the heart problems, and the other organs. So we've never been involved in anything viral related. We're not detecting COVID itself. But what makes up the netosis, which kills you, is large chains of chromatin, which is exactly what we measure. So we thought about it back in February and March and realized there's really no way to diagnose if you have netosis, which again is what kills you. And it turns out there's been a huge amount of work based on netosis. It kills you in sepsis as well, and sepsis is actually the biggest killer in hospitals, and things as widely as also like diabetes and a range of other things. So we engaged, worked with quite a few clinicians, and it showed we can really have a very, very high signal in people with bad netosis through COVID. So now we're working on a range of other conditions to show that if it works in those, and if it does, we can launch a product, I think, this year on netosis. And I think that could be incredibly good use for what we do. There's if you want to try to treat NETosis, which is what causes death in COVID and all those other things, you really need to be able to detect that you have that problem in the first place. Obviously, you're not going to give someone a treatment for NETosis primarily because NETosis is your body's primary defense mechanism. So if someone's sick, you want to make sure they have an excess of it before you start clearing them out for obvious reasons. So that's something which we do a lot of work on. I think could be as big as the vet space and the cancer space because it's a really cutting edge field, and we've really put ourselves in a great position because it's exactly what we detect from the cancer side. It's a different mechanism in the process, but it's an incredibly similar mechanism to what we've been detecting already. So it's again something we can do very quickly, easy and cheaply during the pandemic. So it's very exciting. I think it's just remarkable the breadth of the epigenetic platform that we've developed.
I mean, this is fantastically exciting science. It's wonderful. Let me just go to the investment side. What are the milestones that investors should be looking out for over the next 6 to 12 months?
Well, obviously now we are shifting to the product side after a time developing the platform, and that's typical of diagnostic companies. I think it's a mistake to launch too quickly when you're really not ready, and then you get judged on a product that's really not up to the job. So throughout the year, just on the research and development side, then I'll get to the product side. We have a lot of data coming out on the NETosis side through things like COVID and a bit of sepsis and some of the therapies. We have some data points coming up quite quickly on the lung cancers from Taiwan, so that's something which should have a steady stream of lung data. Also, the colorectal side, we'll be doing bits and pieces more, but that's tougher during the pandemic. We've started the trial now, and switching to the products, we hope to be able to launch a product soon for NETosis. The vet side will be reporting how the sales are going and how we're going to be picking that up through different places, different countries, more labs running our tests, and we're very excited about all that. We'd also expect to have some licensing deals through this year. We're talking to groups in Asia about licensing, also the vet space and also in Europe. And that's the kind of the second stage, launch our own products and start aggressively licensing. So that should be very good. We're just launching our new production facility to make the key components that we can license, not just go to a company and say, do you want our IP, but give them the key components to make it for whatever they're doing. So I think there'll be a lot of data, a lot of product news, and a lot of new product news throughout the year. And I think it's going to be a really, really good year for us.
And how about your cash runway and your funding?
Yeah, so we had about $21 million in the bank last quarter, and we've been burning 1.5, 1.7 up to 2 million, depending on the month. So say 1.7 million. But we have been doing two things to keep the runway quite extensive. We've just announced another batch of non-dilutive funding from the Walloon region, which I think takes it about $13, $14 million from them so far. And we've been raising small bits of money through ATM throughout the year to also extend our runway. So I think we're in a good position to really deliver these milestones this year.
Fantastically exciting, as you say. I mean, 2020 has been difficult for everybody. I'm getting the impression that 2021 for you is looking rosy.
Yes, I couldn't be happier and prouder of the team. I think that one way of dealing with the pandemic would have been it's all a bit too hard. You know, it's everyone's at work from home, and we all know how difficult that can be sometimes. That's where I am now. It can be very difficult, and the team has shown amazing resilience and pride in the work we're doing and commitment to really delivering something very special. And it takes a lot of work to develop a platform when you don't have products and you're developing something really cutting edge that no one else has been working on, and now to show how well it works in a range of areas. I think it's going to be absolutely when we start to really reap the rewards of fantastic work from a fantastic team of people who could really change the world of medicine and science by doing this platform and help a lot of people. So I think 21 is the start of some fantastic products. So it should be really exciting.
Cameron Reynolds, it's been such a pleasure. Thank you.
Thank you, Vivienne, and thank you, everyone.